Thank you, Chair. I have to say, I need to preface this with saying, like, you know, with all due respect, I think the last 45 minutes, especially of this meeting, has been one of the most excruciating things I've ever had to listen to when we speak about drug use in Ireland. I actually can't believe I'm hearing it in 2021. There's a lot more after being said wrong in this meeting in the last 45 minutes than the name of a building in the city centre, and not anybody picked up on that and intervened, such as myths being put forward on gateway drugs, the language that has been used, the moralisation of people's drug use on whether they stay on drugs, don't stay on drugs, that everybody needs to become abstinent. What I don't understand what's after happening here today, Minister, is your statement says, let me be clear, a war on drugs is not an effective response to drug use. Now, the last 45 minutes of this conversation will tell me that we have just watched the complete opposite of that statement. Minister, the war on drugs has happened right in front of your eyes here today, and I'd like people to sit back and watch back this conversation of what they've just listened to today. The war on drugs costs lives, it's discriminatory, it's moralistic, it's a breach of civil rights, it criminalises poverty. If you want to focus on drug use, you need to forget the type of drug that's being used, and you need to look at poverty and marginalisation. Everything that this government has got to say into end poverty and make poverty criminalised. Criminalise poverty, not people for their drug use. But what I've seen here today is every single trope in the anti-decriminalisation and the war on drugs handbook. Minister, I need you now to explain to me what you mean by, let me be clear, a war on drugs is not an effective response to drug use, because I have not witnessed that in this conversation.
Well, thanks very much, Senator Ruane, and look, I appreciate your intention is very well meaning, and we have said the war on drugs, that it hasn't worked, and that's why we've brought in the National Drug Strategy. In 2017,
it's not why we brought in the National Drug Strategy. The National Drug Strategy has been around for a long time.
Yeah, in 2017, and we've had a midterm review.
No, it's this version. The war on drugs is criminalisation. Do you understand that that's what that means, the war on drugs? Is it a reference to criminalisation?
My own view is I don't believe that. I think, again, we were trying
to believe. As a politician, right, that stands over policy, do you understand that the war on drugs is about the criminalisation of people who use drugs? Do you believe drug users are criminals?
No. What I think is that we need to destigmatise issues around people who use drugs.
It's not about stigmatisation, Minister. I'm going to have to keep bringing the basics here. The war on drugs is an American. It came through the UN treaty. If you go back right to the 70s, to your own party, to Fianna Fáil party, you will see the conversation of what the war on drugs means, where the Drugs Act came from, the UN Treaty and the Single Act, and where it actually originates from the war on drugs, which is prohibition and the criminalisation of people. We're not window dressing anymore. It's not a cosmetic thing. We just need to end stigmatisation. That's not what the war on drugs means. Yeah. So I'm not going to allow the war on drugs as an effective response go out in news articles today where people actually got hope in that statement, to then come on here today and listen to what we've just listened to. Do you believe that people who use drugs are criminals?
I think people who use drugs, they have human rights, and they are, you know, we've met Syria, the service users' rights in action, and look, we've said that a health diversion is required, and it's compassion, not punishment. And I think we're moving in the right direction with justice.
You can't uncouple criminalisation from health-led and try to offer them up as two separate things. They are intrinsically linked. We do not reduce harm, increase happiness, unless we actually stop labelling and criminalising people for their drug use. Now, excuse me, Bernard, I didn't interrupt you.
No, you didn't, but you showed dissent. You showed dissent.
Bernard, can you give the speaker the floor?
The working group set up had nearly 22,000 submissions to it in relation to decriminalisation. The evidence was overwhelming to that working group on decriminalisation. The committee ignored it on the basis that we're not Portugal. Can you tell me, Minister, from that committee, was the main conversation that actually the guards didn't want to give up their powers to stop and search?
That's a legal issue and it's a justice issue. But
and we are politicians and we make legislation. As a legislator, do you realise that the situation is in relation to stop and search powers?
Well, I think, seeking to normalise drugs, and it has,
So it's not about normalising drugs, it's about people, and it's about what they do in their lives, their agency, their supports, their networks. It's about not excluding them from society because of their choice to take drugs. It's about fixing the poverty and inequalities in communities so that we don't have chaotic drug use. But your statement was very strong, Minister. So much so I text you this morning to thank you for such a strong sentence in this. And now what I realise here today is actually the war on drugs is an effective response from your view, because we will stand over criminalisation.
Well, effectively, you take one statement out of a statement, but look,
it's very important. It's a very important statement. It's a very important sentence, Minister.
In health, we don't favour criminalisation. We want to support people. And again, I say,
who in health does not favour decriminalisation? So, are you saying that health supports and stands over the criminalisation of people for their drug use?
No, we do not favour criminalisation, but what we have is a health-led approach, and that's the approach.
We don't have a health-led approach because we ban people for their drug use.
Well, it's not a black or white issue.
No,
it's a health-centred approach, and sometimes justice.
Point of order, Chairman.
Is an adequate strategy.
I'm not taking a point of order, Bernard. Let the session finish, please.
Minister, I know I'm coming in hard here, but you have to remember, right? This is an issue that I don't go and visit a treatment centre and ask them a question like, do they support legalisation? What I do is I ask my friends, do they think that they're criminals? I ask my family, I ask the father of my child, is he a criminal for his drug use? He'll tell you no. I don't go and ask him, do you think drugs should be legalised? You have to be careful of the questions that you ask people that have grown up in poverty and addiction, who have internalised that stigma that you speak about, that actually feel, oh no, they shouldn't be legalised because we buy into the moral panic. But we don't talk to them about the conditions of environment in which they live, in which they grow, why they have to self-medicate to that extent. There's a difference between drug use and drug abuse is connected to poverty and it's connected to inequality. And unless we can address that, we can't keep having these pretend conversations at committees where we say big statements like the war on drugs is not an effective response, and then have a committee that is in complete contradiction to that statement. And I think you should withdraw that sentence from the statement that you gave to the committee today.
Well, I think
should there be a war on drug barons? Should there be a war, Chairman, on drug barons? The people who supply the market.
Well, then legalise, and then you'll remove that. Let's have the conversation on legalisation. We gave them the market. We gave drug dealers the market.
Look, I'm confident in Ireland's approach, and look, it's evidence-based. And
it's not evidence-based. The working group ignored the evidence that was presented to her on criminalisation. It ignored the evidence. So don't tell me that this policy is evidence-based. It was one of 3 scenarios put forward, and it wasn't the one that had the most evidence at it.
Well, look, we have different opinions here.
No, mine is not. It's not an opinion. It's not an opinion.
But I believe it is an opinion, and it differs from others' opinions. But effectively, it's important that I think we live up to responsibilities. I think if we were starting out today, would we legalise alcohol, tobacco, and things like that? So there's a huge. I think the consequences of drug use.
That's health-led approach is a prohibitionist, and would also have that discussion about all of. So we've a prohibitionist drugs minister.
No, I think it's a compassionate approach that we have,
it's the opposite.
I think one thing you're right though, we have to acknowledge the social determinants of drug use, I agree with you there. We might take different paths, but I agree with you there that there are social determinants in drug use as well.